I'd like to welcome everyone. Hello, everyone. I'm Dawn Semenko, the LFA Wisconsin Chapter CEO. Thank you for joining us for this month's Let's Talk About It webinar, Lupus Self-Management Tools, brought to you by the LFA Chapter Network. I'd like to introduce our staff members who will be with us today. Betsy Woody is our co-host today and our health education coordinator, and Angie Eckley is our administrative and content coordinator, who will also be helping out. Just as everyone's lupus is different, so are the medical and therapeutic treatments for lupus. Your physician knows your medical history best and is the best person to help in your treatment of your lupus. You can discuss information learned here today with your doctor, but do not make any changes to your medication or treatments without consulting your physician. This webinar is being recorded. Presenting today is Dr. Shivani Garg, who is a faculty member in the Division of Rheumatology within the Department of Medicine at UW Health. She is interested in clinical epidemiology of lupus, rheumatological diseases, and quality improvement projects in rheumatology. Dr. Garg helped establish the first lupus clinic in Wisconsin in 2018 and serves as medical director of the UW Health Lupus and Lupus Nephritis clinics in Madison. Following Dr. Garg's presentation, we will open it up for questions. And if you have one, please click on the raise your hand icon or type your question in the Q&A, not the chat, and we will call on you. So welcome, Dr. Garg, and thank you so much for sharing your time and knowledge with us today.
Thank you, Dawn. Pleasure being here. I would share my screen. So can everybody see my screen okay? Okay. Great. So I would be talking about lupus self-management tools. The next 20 minutes or so, we'll talk about the common triggers of lupus, how to avoid common triggers to prevent flares, and severe, mild, moderate, or severe flares. And also we'll talk about some self-monitoring symptoms of a lupus flare, just to know more what to monitor for, how can we predict or identify those subtle symptoms, and when to call your physician. Let's start with something which is known. We know that female patients or women often get more lupus, 9 times higher risk of getting lupus compared to our male patients. There are ongoing studies that have shown that there could be a correlation with estrogen or the extra X chromosome in females, but still we are trying to figure that out, like how this is leading to a more female predominant presentation. We all are aware that lupus affects people of color more often, and not only they have more lupus presentation, but they also suffer from severe lupus and do get diagnosed at a younger age. Next is the hereditary predisposition. So there is an association of 30% when an identical twin could develop lupus if his or her identical twin does have lupus. And there is a 5 to 10% genetic predisposition or risk in first degree family members or relatives or a fraternal twin to develop lupus. Then some common triggers that we are all aware of: sunlight, especially the UV rays, viral infections or infections in general, stress, and smoking. So, and then we're all aware, or maybe not that aware, of sulfur medications. So there is anecdotal evidence that sulfur medications can lead to hypersensitivity in patients who have lupus. And there are some case reports or studies that have shown that sulfur-containing medications, especially antibiotics like Bactrim, can lead to lupus flares. So just having a caution around sulfur medications would be a good idea. So now that we know or have brushed our knowledge about triggers, let's talk about how these triggers interplay at a cellular level. So we talked about our common triggers: UV rays, viruses, stress, sulfur, and smoking. When a patient who has a genetic predisposition or other reasons to develop lupus or has lupus, when these triggers get exposed to that patient, there is a lot of destruction and cell damage that occurs. And that cell damage leads to formation of antibodies. And those are the anti-nuclear antibody or ANA antibody that we are all aware of. So triggers lead to more antibody production, antibodies to the inflammation. So then the patient or a person is tied up in this vicious circle of inflammation. So moving forward, now that we know our triggers, we know how they affect at cellular level and lead to more formation of antibodies or ANA. And then let's talk about how we can avoid these triggers or can incorporate in a lifestyle change. So the first and foremost trigger is sunlight. So sunscreen use, SPF 30 or minimum is a good idea. Um, Often we only use sunscreens on the exposed body parts, but it would be a good idea to put it on unexposed and exposed body parts, just because the clothing that we usually wear is not UV protective. Also, one thing to keep in mind is that sunscreen often stays only for 2 to 3 hours. With perspiration or sweating, it often the action is not there. So reapplying sunscreen after 2 to 3 hours is a good idea. There have been studies that have shown that patients who use sunscreen regularly compared to who don't, uh, the patients who are using sunscreen do tend to have less flares compared to those who do not use sunscreen. Other ways of protecting ourselves from sunlight or UV rays is by using UV protective clothing or wearing hats. Um, the direct sunlight, often during 10 to 4 p.m., has very high UV index, so it can lead to flares even after short exposures. So trying to limit the exposure during that period would be a good idea. And then moving on to what medications can help reduce such kind of flares after common exposures. Hydroxychloroquine is a key medication. Hydroxychloroquine medication, studies have shown that patients who take hydroxychloroquine not only tend to flare less, but also they have prolonged survival compared to patients who do not take it. And there is increasing evidence on vitamin D supplements. Vitamin D deficiency or reduced low levels. There are studies that show that can increase the risk of flares. So taking vitamin D supplements regularly is always a good idea. And if the levels are low, taking the high supplement and rechecking the levels could prevent sun sensitivity, could prevent some of the flares from occurring. The next common trigger that we talk about is stress. Stress can be physical, can be mental, emotional. So there could be different forms of stresses that we get exposed to in our day-to-day life. So trying to avoid stress, which is inevitable, but trying to manage stress better is a good idea to prevent some of these flares from happening. Stressors could be anywhere, but some strategies like meditation, yoga, have shown that they can improve stress and reduce some of the quality of life patients experience. And also there is a new strategy called mindfulness-based stress reduction program that could also help process stress and with mindfulness-based strategies or techniques, and help reduce stress or manage or cope up with stress better. Some studies have shown that such activities definitely leads to less stress, better quality of life, and less flares. So managing stress is important, especially in patients who have lupus, to control or keep lupus at bay. Moving along, we talked about infections, specifically viral infections, and some bacterial infections or infections in general. So the key ways of preventing infections is by vaccination. Common infections like flu, pneumococcal pneumonia-related pneumonia can lead to are all triggers, and they can lead to flares in patients with lupus. So it's a good idea to get vaccinated or get the prophylactic vaccination whenever you can. We talked about mindfulness-based stress reduction program and just wanted to highlight that there are studies that have shown that it improves the quality of life that patients experience by experiencing less stress and less flares. So that could be a strategy that could be considered to manage or avoid some of the triggers. And now moving to sulfur. So we talked about sulfur hypersensitivity. So there are studies that show that lupus patients could be hypersensitive to sulfur compared to other patients. And there are case reports that have shown that at times sulfur exposure can lead to a lupus flare. So just a caution around sulfur medication when first prescribed should be a good idea, or if there are some subtle symptoms that indicate that there could be a lupus flare, preventing such use or using alternatives could be a good idea. And the last and for the most important is smoking. We all know that smoking can lead to lupus flares, so quitting smoking is a good idea to reduce lupus flares. But what we don't know is that when we smoke, a lot of these good medications that we use for lupus, they're not as effective as we want them to be. Specifically hydroxychloroquine, it does not remain that effective in patients who are smoking compared to who are not smoking. So reducing or trying to quit every time is a good idea. Also, what we don't know is that smoking can increase the risk of heart disease. Lupus itself can increase the risk of heart disease. When we combine smoking with lupus, they both can exponentiate or like increase the risk of heart disease several folds. So quit smoking today, or maybe cut down and plan about quitting smoking, not just because it would reduce the risk of having flares, but it would make your medications more effective and also would reduce the risk of having heart disease. So just wanted to briefly talk about COVID vaccination. During the pandemic, we talk about vaccinations as prevention. So what about COVID vaccination and its safety in lupus? There have been these several studies, but these two were big, large sample size studies. One was done in France, the VacoLoop study, which had 696 patients. And the study did report that only 3% of the patients suffered from medically diagnosed lupus flare. They did report that there were some reactions, which were local reactions or some fatigue symptoms that were perceived to be because of the vaccine, but none of these symptoms progressed into a severe lupus flare requiring therapy. And the vaccination composition in the study was 55% Pfizer, the mRNA vaccine, and then there were other vaccines in the remaining population or patients. Another study, which has 1,377 participants, looked at only patients who got mRNA vaccine. This study did highlight that there were 11% reactions, but none of these reactions were severe symptoms of lupus, or there were no severe flares of lupus. So the reactions which they noted were local site reactions, maybe some soreness in the arm, fatigue symptoms. So just the usual achiness or soreness in different joints, but no severe symptoms or flares of lupus. So overall, the conclusion was that COVID vaccinations do not increase the risk, significantly increase the risk of flare. And in comparison, COVID does increase the risk of having severe disease and poor prognosis if a lupus patient gets infection and gets hospitalized. So contrast of the low risk of lupus flares, approximately 3%, or even lower, and its benefit. COVID vaccinations are recommended by Lupus Foundation of America, American College of Rheumatology, and endorsed by CDC in all lupus patients. So that could be one strategy during the pandemic to prevent flares from happening by getting the vaccinations in time. So just to reiterate here, I pulled this self-management goal setting from Lupus Initiative, and just wanted to highlight few things that we can work to prevent triggers or can incorporate in lifestyle to prevent flares. So the first is healthy choices. So some foods can cause do have high levels of antioxidants. Some foods can make us bloaty, feel different. So just knowing what suits to your body and trying to increase healthy diet, which is antioxidants, less of processed foods, would be a good idea. And also balancing out the sodium and the salt intake, especially if we have kidney involvement, that would be a good idea too. We talked a lot about reducing stress because stress can be in any form. It could be physical, it could be mental, it could be emotional, or it could be a combined of everything. And especially with the pandemic, there is a lot of stress going on with everything changing or everything looking different. So just trying to know what leads to stress and trying to know what can be done or what works for you to de-stress yourself or to relax would be a good idea. Sometimes it could be as simple as listening to music. Sometimes it could be a yoga. Sometimes picking up the phone and talking with a family member could help. So just knowing what helps would be a good idea to reduce the stress and prevent lupus flares, or in general, make your quality of life better. We should all try to aim for better emotional and social wellness. What it means is that because at times, especially in pandemic, we feel so socially isolated, or we felt so socially isolated. So just building on healthy relationships, trying to make your family members or partners understand what lupus means or what lupus could cause or is causing helps. And sometimes if you cannot find support around because people cannot understand if they're not in the similar boat, then finding help outside by joining support groups could be a good idea. The next thing that can be a lifestyle management is being active, exercise, and sometimes it sounds like an vicious circle, because if you do a lot, you hurt more, you feel fatigued, and then you don't want to do a lot. So why do we tell patients or we tell people to be active? So we understand that sometimes doing just that initial normal walk might not be normal, because everybody is different and dealing with lupus makes your body different. But taking the first step is important because it is important because your body feels different, so it cannot do the 2-mile walk as it would want to do. But doing a first, like maybe 10 steps would be the first goal for the first week, and maybe increasing every day would help set expectations, would help build stamina and reduce the symptoms that you feel. So just starting or thinking about getting active is the first step. And then we are not recommending doing like 2 miles right away, just like building slowly on your stamina is the way to go around. But exercise does help release these endorphins, which are really helpful for reducing stress, not only stress, but also feeling good. So exercise helps with that part, but also exercise helps with reducing some of the things that we would see later in lupus, maybe heart disease, maybe loss of strength in the muscle, so, or maybe poor bone health, which means maybe higher risk of fractures. So exercise or being active helps your helps reduce some of the emotional mental stress, but also makes your body stronger from inside. And then we talked about smoking. We cannot emphasize more how much smoking can harm your body. It can harm not only, we talked about lupus in general and heart disease, but we also see that it can increase the risk of having high blood pressure, which can worsen your kidney lupus. And often it can make your skin disease look worse or difficult to control. So just quitting, taking the first step to cut down and then maybe quit on smoking is the way to go. So now just switching gears to talk more about self-management, from self-management to self-monitoring. So just knowing what these, what the symptoms you could look, what symptoms you could look around to identify subtle or early symptoms before a full-blown flare could happen. Rash is a common presentation. So there are more than 80% of patients would have some kind of skin manifestation with lupus. We all know the butterfly rash. Interestingly, the butterfly rash is more painful, sometimes can be burning, can be itching, just because it's an inflammatory rash. And it does spare some of the nasolabial folds, which are around the nose. And that could be because the malar or the cheek area is prominent, and most of these rashes are triggered by UV or sun exposure. So the prominent areas prevent sunlight from falling onto the nasolabial folds, and that is a key sign of lupus rash. So just knowing if it is more of a flushing or a rosacea rash versus an inflammatory rash could be would be helpful. And then the other rashes that we can see are on the chest area. So they look like ringworm, but they are not itchy. They sometimes are painful, and they just keep on increasing in size. So at times, when it comes for the first time, often patients describe it like it looks like a ringworm, but it is not itchy. So that is something that you can keep in mind if a rash is just red, inflamed, and looks like a ringworm. It's not itchy, and it just keeps on growing in size. And it is on the sun exposed areas like our V area with on the chest, or could be on the back or upper extremities. So just keep that picture in mind. And sometimes the rash could look different in people of color. It could be more thick, because of the chronicity, which means like it has been going on for a long time, and it could have flaky, or it could have like a flaky pattern or a scaly pattern, which shows that the rash has been just going on, the inflammation has been going on for a long time. So just knowing that the rash could look different, but knowing where the rash is occurring and if it is painful, burning, or is getting worse or getting bigger is always helpful. Again, rash could be different. So if the rash is unusual and does not fit the pattern of what we would see normally, does not mean that it is not lupus related. So always keep in mind something new or something which is not getting better and has been there for a long time, comes after sun exposure, could be lupus related. So the next common symptom is joint pain. So when do we get worried about joint pain? Joint pain is there. Lupus changes our body so much from inside that we do feel the pain, stiffness, very different. So we should get worried if we start noticing that the pain is present all the time. It is not getting better. It's worse when we wake up in the morning, just because our joints are not in use in the morning. So when we wake up, they feel rigid. They feel as if you have gloves on and you cannot make a fist. So that kind of symptom, when it is worse in the morning, gets better with like just regular movement, is a key sign that there is significant inflammation in the joints. Often it involves more than two joints at a time, but it could occur in one joint. So just keeping in mind the key symptoms would be a good idea. And if you start noticing swelling in the joints, that would be again another sign. If we cannot fit our rings correctly, they get stuck at the joint, that probably means either there is some kind of arthritis that is occurring, or there is a joint swelling, or if the joints look red, hot, inflamed. So those are all signs that if the pain gets worse, it's worse in the morning, gets better with activity. If it is swollen and we cannot fit our rings, or they get stuck at our joints, or if there is red, hot, swollen joints, those are all signs that we should be monitoring for symptoms. So the deformities, or like when the joints look change forever, does not happen that common in lupus, but just be aware that in case the joints, the fingers are turning, or they look a little bit knobby, and they are bent, they are not like moving correctly, or you cannot straighten them out, that means that there could be some kind of inflammation going on in the tendons. So you should call your doctor as soon as possible. Now moving on to ulcers in the mouth. So we often talk about sores in the mouth, but lupus causes a different kind of ulcer or sore. So ulcer is more like a wound inside the mouth. It is not a bump, but it is like a cavity or depression. And sometimes it can be painful, sometimes it cannot be painful. So just knowing that if it is feeling like a raw open area and it feels like sometimes like a cavity, or it is painful, that could be a sign of lupus flare. And then it's most common on the top of the palate or the top palate, but it can occur on the cheek, like the inside of the cheeks, or on the tongue too. And next we talk about kidney lupus, because kidney lupus is one of the most common severe manifestations of lupus. Just looking at your urine can sometimes help. As we can see in this figure, if you allow the urine to stand, there should not be anything which looks like foamy or frothy. But if there is protein in the urine, there would be this froth on the top of the urine that looks as if there is a lot of foaminess or soapiness in the urine. That is a very concerning sign. If you start noticing that even after letting the urine stand for several minutes, there is soapiness or foaminess to the urine, you should call your doctor as soon as possible and get a urine test done. Sometimes we also refer this to as like a beer heads, because the top is frothy and bubbly, as we would see in on top of beer. And then if you start noticing swelling around your ankles, around your eyes, that would be another sign that you need to monitor your blood pressure or call your doctor as soon as possible. And then monitoring blood pressure is something that all patients should be doing, either at their primary care's office, or if they have kidney lupus or have uncontrolled blood pressure, they should be monitoring blood pressure at home as well. And now we talked about some kind of some heart and lung disease that can occur in patients with lupus. We should all never ignore chest pain, because chest pain could mean a lot in patients with lupus. It could be a sign of inflammation. It could be a sign of heart disease that's occurring. And it could be a sign of some kind of damage that is occurring. So we should never ignore a chest pain. Chest pain is a symptom that you need to call your primary care, you need to call your doctor as soon as possible. And some characteristics, we should all be aware that if the chest pain gets worse with activity, better with rest, it means that there is a circulation issue, and there could be some artery clogged up because of inflammation or because of atherosclerosis or plaque. Or if the chest pain is sharp, squeezing, gets worse when you lie down flat, and that is another thing that you need to keep in mind, because that could be a sign that there could be inflammation or fluid around the heart. And if the chest pain gets worse when you take deep breaths, that could be a sign that there could be inflammation around the lung lining. So those chest pain should never be ignored, period. And other things that we can monitor is that sometimes as female patients, we might not experience chest pain. We might experience some different symptoms, which are known as angina equivalent, which just means that we often do not portray or present with the same symptoms that we should, the textbook says. So shortness of breath with regular activities, if you can climb a flight of stairs without getting huffy puffy on the top, it means, and now you are getting a little winded or feeling huffy puffy, it means that you need to get evaluated as soon as possible. Any kind of cough or bringing up blood in your sputum or phlegm, that's not normal. So those would be some symptoms to keep a close eye on. And if those are occurring, you need to call your doctor right away. Or if the pain is getting severely worse, you need to go to the ER. So those could be another thing to monitor about. So self-care, this is a self-care tool from Lupus Initiative again, and just wanted to highlight that the tool highlights or helps you track your new symptoms when they started, to prepare a journal, and also helps you document the key things that you should be monitoring. And then there are other portals to help other educators and patients through Lupus Initiative. And then there are other, we also created a website where we have symptoms and symptom tracker, and all the information is curated from our from medical literature review, so that could also come in handy. So finally, just wanted to thank you all for your attention, and just wanted to let you know that we are all in this together, your providers, you yourself, your families, and we will help or support you as you want. Thank you.
Now I think there are some questions that are in the Q&A session, and I have some that I came up with as well. So I'm going to ask these. People, feel free to keep typing your questions in. If you type them in, I will say what they are. Otherwise, if you want to raise your hand, we can do it that way too. But I see right now there are 4 questions in the Q&A, and I have several of my own as well, Shivani. So I'm going to start with these. And I'm sure if one person has the question, so many times several people have questions. The first question I have says, I was prescribed, I apologize for my pronunciation in advance, sulfasalazine by my rheumatologist. Is this potentially making me feel worse? Also, should we tell doctors we are quote unquote allergic to sulfa drugs?
Sorry, can you talk about, can you repeat the allergic part of the question again?
Which part do you want me to repeat, Shivani?
The part, like, should we tell our doctor that we are allergic to? Is that correct interpretation?
Yeah, what she asked was, should we be telling our doctors we're allergic to sulfa drugs? Maybe just as a way for them to be aware. I'm guessing that's what she meant. She can clarify that if she wants. But should we be telling our doctors we're allergic to sulfa drugs, or that we're just hypersensitive to them?
Yeah, that's a great question. So often we do not use sulfur containing medications in our practice, but everybody's practice is different. So it might, if you're not feeling good after being started on sulfasalazine and you do have lupus, it might be a good idea to start a conversation with your doctor that you're not feeling better, maybe feeling worse. So just a good idea to start that conversation. Then the second part, telling the doctor about being allergic. So I think allergy can be perceived in several things, because if you put an allergy and you do not have an allergy, sulfur, like low quantities, can be in different things. So we don't want that, like good things which do not lead to reactions, not to be given to lupus patients. So report allergy if you have an allergy, but you should make your providers aware that there are some reports about this hypersensitivity. So do you need to be concerned about being on the sulfur medication? Or if there is an alternative, like mostly there are several alternatives that could be used. So that's a good idea to bring up, um, to start a discussion with your provider.
Okay, thank you. The next question I have here, and I'm actually going to piggyback on this question because I do have some questions about this as well. The question that was asked in the Q&A is the third dose or the booster recommended for lupus patients? And then my question regarding that, is there any circumstances where you would not want that patient to have it, just specific to certain medications, a specific lupus patient is on that? Or would you pretty much recommend that booster for all lupus patients?
That's again a great question. So booster, so the new categories that got approved recently does have a chronic medical condition category. So all lupus patients, regardless of what medications they're on, should be getting the booster vaccine. Few few conditions or few presentations or scenarios where I would be a little bit cautious with a booster is if a patient had severe allergic reaction to the vaccine.
Mhm.
The other scenario is sometimes patients had COVID, then they had their booster, and the booster is an immune response, so they can feel strongly after, or strong immune reactions after, but it's not quantifiable as an allergic reaction. So I might want the patients to maybe consider taking a Tylenol on the day of vaccine, or maybe the day after. So that could be like one kind of scenario that could be brought up, that with a provider, and I often bring that up with my patients too, that I felt too bad after the COVID vaccine makes me feel nervous about getting this booster. So can I take this to help? Or could I do anything to prevent that kind of immune reaction? Just because feeling achy, sore, though we know it's good that your body is responding, but sometimes if we have to do our job, having a headache, feeling achy, sore is not the best feel. Um, Certain conditions, and just to remember that when we say like a chronic medical condition, where lupus qualifies, uh, the duration between first two doses and booster is different if you're on a medication which qualifies under immunosuppressant category versus you're just on hydroxychloroquine, or maybe on no medications. So the booster for patients who are on medications for are on immunosuppressant medications is within 20 after 28 days of dose 2. But if you are not on immunosuppressants, you're just on hydroxychloroquine, or maybe you're on other you're not on any medications for lupus, then your gap, or like your wait period, is 6 months. So you need to do your dose 1, dose 2, and then 6 months after your dose 2, you get your booster. And then the last scenario which comes to my mind is that being aware that the booster is not the same dose for Moderna. It's a half a dose booster. So just being aware, and sometimes just asking ahead is not a bad idea, because it's your health. It's never a bad idea to bring up a question. It's always an intelligent question that you bring up, because it's your health and we want the best for you. And then finally is that Johnson and Johnson, still the booster is not approved. We might hear that from in in the future. So those would be the key things that I would keep in mind. Boosters, again, are good, especially if you're on an immunosuppressant. Studies have shown that immunosuppressants do tend to decrease, like not decrease, but the antibody response is not at that level. So the booster actually brought it to the level that they saw in patients who were not on immunosuppressant therapy. So yeah, boosters is a good idea, but just knowing what happened with the previous vaccines would help you to plan this booster better, and then just knowing which category you are in and which booster, which vaccination you're getting would all be helpful.
Thank you. I have quite a few more, Shivani. So another question I have here is it true that only the early morning sun between 7 a.m. and 9 a.m. generates vitamin D? And as we get older, is it harder to convert sunshine into vitamin D?
That's a great question. I think it's the UV rays. So the UV rays penetrate through the skin, and then skin converts it into an active form of vitamin D that helps retain, that helps with all the hormonal and metabolic activities. So it's basically the UV rays. So UV rays are there even in winters, but it is just that the UV index is not that high, so we cannot convert that great, especially in winters like in Wisconsin. So I think vitamin D happens like conversion happens all the time when we are out in the sun. But with sunscreen, sometimes that conversion can be tricky because we are preventing the UV rays to penetrate our skin. So that's why we would recommend, like we usually recommend, just taking those supplements. Often lupus patients are on steroids, so that makes it a little tricky too, because steroids can reduce vitamin D levels in the body. It has that catabolic effect. So just knowing, that's why we always supplement calcium and vitamin D in patients on steroids. So those two things would be a good idea to keep. Over a period, like age, the conversion could be different just because maybe there are different factors that come into play. So it could be different, but I can like look into literature, like how age affects vitamin D conversion. Okay. I might turn on my lights.
Thank you. The next question I had is from someone who's newly diagnosed. So this is a great question. How to know when I have a flare versus it's just a different, maybe lupus issue?
Mm-hmm. That's a great question. And I think from a new diagnosis perspective, I feel what I tell is look for what were your symptoms when you got diagnosed with lupus? Keep a track of those symptoms. So journal is a really good idea by keeping a track of like, what were the symptoms? I got diagnosed with a rash. Maybe the joints were swollen. Maybe it was my kidneys and I was noticing puffy eyes. So those symptoms, tracking those symptoms could be the first start. So if you're not developing those, it's a good sign that those are not coming back. But then looking at the other symptoms that we talked about, are the joints stiff? If I never had joint stiffness, it's very hard to understand like what joint stiffness means. So just noticing if it is something different. So journal it. And what I recommend is that you should monitor it over a period of time. So obviously severe symptoms, chest pain, you should not like monitor over a period of time, just call your doctor. But certain symptoms like I feel achy today, maybe I have a knee pain, the other day it's my ankle. So just monitor those symptoms. Like if it is persistent every day, maybe it is related with your lupus. And then final thing is that when in doubt, never a bad idea to call your doctor, because we are here for you. We want to help you. Initially, when you get diagnosed, it is very difficult. It's challenging. It's life-changing. Now you went from no medication to maybe 6 medications. It's different. Life is different. Your body is different. So we're here to help. So if you're in doubt, it does not make sense, calling the doctor never hurts. So those would be my recommendations, and hopefully that helps you.
Thank you. I have a couple questions that came in chat, and I'm going to ask those as well. This one is a really good question. I had this question myself, is should the flu shot be taken weeks away from taking the COVID booster shot?
That's a great question. So there are no guidelines, but it might be a good idea because previously when they rolled out all vaccinations, they wanted patients not to take any other vaccination for 14 days. What I have commonly seen, maybe wait a week or two and then get your booster done.
Okay.
Oh,
And
sorry,
then,
flu shot done, or vice versa.
okay, so either way, but have them maybe space them a week or two apart.
Yeah, for two reasons that we do not exactly know that if there is an interaction or if it can reduce the antibody production for COVID vaccine. And the second thing is you don't want two vaccines which can make you feel sore. So you just
Oh.
space them out and feel a little better.
Okay. And here's another question, and this is really a good one too. Should we also be taking the vitamin K2 with our vitamin D?
So vitamin K can be tricky, especially if you are like vitamin K. We don't have like enough studies on like whether it would be relevant with patients with lupus. And I sometimes get a little bit worried because there are some antibodies in patients with lupus that can increase the risk of blood clots. So if you take vitamin K, which can increase the risk of clot, not that much, but can increase the risk of clotting, so would be a little bit tricky. So specifically taking vitamin K would not be a great idea. Talk with your doctor. But the second thing would be just taking a multivitamin would not hurt because that's balanced out based on everybody's nutrition, like average nutrition.
And when you speak about an antibody for clotting, would you then suggest, and I think this is what this would be, is so someone who has like an antiphospholipid antibody should probably not be taking the vitamin K?
Yeah, because if they have antiphospholipid antibody or they have antiphospholipid syndrome, they probably would be on blood thinners. So vitamin K is like it's antagonizing what the blood thinner is doing.
Okay, contraindicated.
Yep.
Okay. Here is another good one. And I know this is probably going to have a huge variance in the answer, but how long does a lupus flare typically last?
It can be different. So
Yeah.
Everybody's flare is different. Everybody's body is different. Sometimes mild flares can take resolve by itself, or maybe rest can help. Hydration sometimes can help. But often, if it is a moderate to severe flare, or if it is a flare with a rash and the sun exposure is continued or the trigger is continued, or if there is a flare of the kidneys, it stays till the time we take care of it. So yeah, so some things to keep in mind that if it is not getting better, so probably might need a little boost to the medications to help control it.
Thank you. Here's another one. Are people with lupus more sensitive to the paralytic used during surgery? And does the body clear the drugs slower than other people would?
So not much reports on the sensitivity to anesthetic agents or paralytic agents. Not a great, lupus patients do not metabolize or clear medications differently. It is when, in general, but in case you have kidney involvement or you have liver involvement, those could be conditions where the metabolism looks different. But in general, if everything or the function, kidney, liver function are normal, we should not metabolize our medications differently, though there could be some medications which can interact and can lead to different metabolism.
This one, I might mispronounce a word, so I'll do my best. It sounds very specific, and this might deal with estrogen a little bit too. I'm not really sure, Shivani. Could the reason or purpose for micro chimerism in women be the reason for higher frequency of lupus in women compared to men? And does microchimerism possibly prevent an allergic reaction in a woman to the presence of a male fetus?
That's interesting. I'm not sure if microchimerism is, let's see.
I'm not familiar with that either.
Yeah. So it probably, I can just tell that we are still trying to, research is going on about genetic focus. So probably we're talking about genetics. So we have 26 genetic foci that are of interest, but still we have not found like the actual foci that we can monitor regularly. And we can predict that these patients would develop lupus. So it's work in progress. We're getting there, but still we don't have like that clarification. I can again like highlight that there could be a role from that extra X chromosome, but again, this is all like hypothetical based on like very bench research or basic science research, not seen in like bigger studies. So, but there could be an X chromosome related effect because male patients tend to have less lupus because they have only one X chromosome. But there is a category called Klinefelter syndrome where there are two X chromosomes with a Y chromosome. So in those patients, they tend to have 14 times higher risk of lupus compared to male patients. So there could be some genes that we need to figure out on the X chromosome, but works in progress. So I would like say we know a lot about lupus, but we are trying to know more about lupus.
I'm thinking back to some of your discussion you had about the incidence of the heredity statistics on that correlation. And you had mentioned twins and I think siblings. I was wondering if I could broaden this question, and you may or may not know the answer, you may have some generalities. I'm wondering if you have the statistics on a mother-daughter relationship, and then also a familial relationship that isn't necessarily the disease, but saying, I have lupus, what is the probability of one of my siblings having a different autoimmune disease like MS or diabetes or ankylosing spondylitis or something like that?
Yeah. So that percentage is almost similar to fraternal twin percentage because the genetic makeup is almost similar to fraternal twin genetic makeup, or maybe less. So it's 5 to 10% for first degree family members. So mother daughter or maybe father daughter. Um, so those would be like 5%, 5 to 10%. And it is general for any kind of autoimmune disease. So it's not just lupus. So if family member has lupus, then they can have higher risk of having rheumatoid arthritis, or vice versa, that the family member has rheumatoid arthritis and now patient is presenting with lupus symptoms. So there is an autoimmunity hereditary predisposition, and that's 5 to 10% in first degree relatives.
Okay, thank you. I'm going to try to get the last questions in, Shivani. I want to be really respectful of your time, but I still have a few more here. This one is pretty specific. I've had both the Moderna shot 6 months ago, and I've had a Pfizer booster as soon as it was available to immunocompromised patients, and I've had no negative reactions. So that's really more of a comment that I don't even think that's the recommendation currently, that you mix vaccines. I know there's studies being done on that now, but I'm glad that this person is happy with the result that they got. I don't know if you want to speak to that at all, like mixing the vaccines, doing 2 of Pfizer and 1 of Moderna or vice versa.
Yeah, that's a great point. For now, no, it's not recommended to mix the vaccine just because the literature is not there. So sometimes, like if it is not effective, we would not know because you're not doing like an antibody response in everybody. So yeah, would not recommend at the moment, but things are fluid and that's what I've learned in COVID pandemic. Things are fluid. So it might change in the future, but yeah, we should stick to the recommendations that no mixing and try to get the booster of the series that you got previously.
Okay. The next couple here is there any correlation between systemic lupus and extremely dark eye circles, like the big circles you get
Mhm.
in your eyes? Or do you think it's just genetics, sleep?
Yeah, so I would say that if there was a rash there, like red inflamed rash, and now you have darkening or skin looks different, or the pigmentation looks different, it could be lupus related. Often when we see these rashes that occur for several weeks or months, they can cause color changes inside the skin, and it can either look lighter or darker, and it takes time to even out. So it all depends on what initially there, how it started, and then what led to the dark circles. So yeah.
And I think I'll just ask you like two more because we're getting close to our 7 o'clock time, and I want to be very respectful of everyone's time. This one is interesting, and I think I've experienced this myself. A lot of people might have. I keep injuring tendons in various parts of my body. Is this likely due to lupus?
So that's common. Like a lot of times, that's why you would not see a lot of erosions, like bone destruction in patients with lupus, because the inflammation is often in tendons. So sometimes patients do present with different tendinitis and 2, 3 tendons inflamed at the same time. So yeah, could be because of lupus, as long as there is no injury explaining the tendinitis.
So if it seems spontaneous or erroneous, it could be from
It
lupus.
could.
Like, yeah, you can't point to an injury for it.
Yep.
And here I think this will be our last one. Can lupus also cause blood clots?
So, great question. Lupus in general, when the inflammation is really high, and that's some of our work that's going on, it can increase the risk of blood clots. And then the antiphospholipid antibody that we talked about is very common, and mostly, like most common secondary, which means like it's most commonly seen in patients with lupus compared to other autoimmune disease. So that makes it the other risk factor to have blood clot. So and if you have kidney lupus, that's other risk factor comes to my mind. Kidney lupus causes inflammation, makes you dump out all the good protein in your urine. So when you have dumping out all the protein, all these anticoagulants in the body are protein. So we are paying out almost all protein and increases the risk of blood clot. So very severe inflammation, antiphospholipid syndrome more commonly, and then lupus, kidney lupus, which probably is part of that very severe inflammation, are the common causes. And then some of our work is focused on looking at lupus, and that is a known fact that lupus is an independent cause of stroke in heart disease. So that, again, it's a different kind of clot, but again, probably lupus related along with other factors.
One more question that's really general and I can't resist, so I'm going to ask it. I've had lupus for, let's see, 32 years. So a very long time. As a physician, and my treatment has changed so much over the course of my illness. As a physician, could you tell us all, like, if you were to have your quote unquote dream patient, what are the most important pieces of information, like to utilize our doctor appointments really efficiently? What are the most important questions, or what are the most important things we can tell you when we come into your office?
Yeah, that's a great question. I think most important things which I would want to know, or which I ask all my patients, is like, how are their previous symptoms doing of lupus? How are any new symptoms? And then we go over a list of our symptoms, often call it a symptom tracker. and then talk about how their medications are going. So just knowing like struggling with medications, and doctor is a family member, so be open if you are struggling with medications. Us knowing would help you or help Lupus, because we're in this together. So talking about medication, struggles about medication, maybe side effects, so just openly talking about those. And then in general, anything comes up about like, I read this and this is my concern. So anything new comes up to your mind, new concerns or new things which causes stress. And then I often want to know how you're feeling. Like, are you stressed? Are you having an emotional breakdown? Is pandemic not is like making you feel even worse, or is there somebody who can help you? So those kind of questions always help not just treat lupus, but help you feel better. Because at the end, we just are not here to treat your lupus and then that's done. Our job is done. We want you to feel better living with lupus, more confident living with lupus. So those are the things that you can prepare ahead of time. Sometimes the journal, the track symptom journal helps. Like patients bring, they have noted everything down. I remember, I know most of the patients have fogginess, which is normal, like which is just so overwhelming disease, and then so many symptoms that you can get fogginess. So just that journal helps, and they bring all the symptoms in, like maybe their iPad, maybe their phone, or maybe their a notebook, or maybe a friend who remembers everything. So that is the way to like jot everything down and be open about what you're feeling and how you're feeling. There is no why. Everybody is different. So I don't think anybody judges. It is just, we want you to feel better.
Thank you.
Thank you.
Dr. Garg, thank you so much. We got through most of the questions. There were a couple left, so I apologize. Majority. I want to thank Dr. Garg for her time. This was an excellent presentation. And I just want to hand it back to Dawn for a minute to kind of give a little conclusion for us, or?
Sure. I just wanted to thank Dr. Garg and thank everyone else for joining us tonight. Please keep an eye out each month for the Chapter Network Let's Talk About It presentations. So thanks again to everyone. We hope that you learned something tonight, and so have a good night.